The Central Valley is home to more than 2 million people. What if we could help everyone live their best life instead of worrying about heart disease and stroke? What if no one struggled to have 3 healthy meals a day? What if, when someone you know suffered a cardiac arrest, you or a member of our community responded right away? The American Heart Association is working right here in the Central Valley to address questions like these. Our mission is to be a relentless force for a world of longer, healthier lives. And it starts right here in the place we call home. Jody, wife and mother, suffered a heart attack and a stroke. The problem? Extremely high blood pressure. Jody is not alone. An estimated 630,000 individuals in the Central Valley are living with high blood pressure. That's enough people to fill Bulldog Stadium about 15 times. Uncontrolled high blood pressure increases the likelihood of heart disease and is the leading risk factor for stroke. To help prevent and address hypertension, we're empowering people in our community to regularly check their blood pressure and take steps to manage blood pressure. We're going to workplaces, community centers, and clinics.
What we know to be true about hypertension is that the incidence of hypertension increases with age, and we know that more people who have a family history of hypertension are likely to develop it. But I want to also talk to you about prevention. It's very important that we focus not only on our health as individuals, but the health of our communities. And for me, creating a healthy community is also about making sure that we have access to healthy, nutritious foods that everybody can afford to eat on a regular basis. And it's also about making sure that we have safe places so that everybody can engage in regular physical activity.
Yet, it's more than just individuals reducing their blood pressure. We've made a commitment to improve how providers measure and provide care for patients living with high blood pressure by ensuring they have access to the latest science and best practices. The most basic needs can be critical for a person's health. We know that our bodies benefit from a healthy diet, but for many of our neighbors, just getting enough food is a daily struggle. In fact, Fresno is the second most food insecure city in the United States, with more than 24% of our residents unable to put food on the table consistently. Within our 6 counties, 45% of our community lives in areas with no to low healthy food access.
So sometimes we might get asked, what is nutrition security, or why is AHA involved in this issue? So nutrition security exists when all people at all times has physical, social, and economic access to sufficient, safe, and nutritious food that they need to meet their dietary needs and food preferences and to have an active and healthy life. So nutrition security is that intersection between food security, or having enough, and nutrition, having all of that quality that they need to support their best health.
Many barriers stand in the way of access to healthy foods. Lack of grocery stores selling fresh fruits and vegetables in neighborhoods, affordability, and sometimes lack of cooking skills or knowledge to make healthier choices. In cooperation with others in the community, we can work together to address some of these barriers. Efforts like asking patients in clinics if they have access to 3 meals a day, and if not, helping to enroll them in food programs like SNAP to make affording healthy foods less challenging. Connecting families with healthy food and veggie vouchers, allowing them to supplement their other food sources with a regular source of healthy produce items, and stocking shelves at local food banks with healthy and culturally appropriate food choices. Every year, more than 350,000 out-of-hospital cardiac arrests occur in the U.S., and about 70% happen in homes. Survival depends on immediately receiving CPR from someone nearby. But currently, bystanders only perform CPR 46% of the time, and in some communities, rates are even lower. Citizens from primarily poor, Hispanic, or African American neighborhoods are more likely to have out-of-hospital cardiac arrests and are less likely to receive bystander CPR.
CPR disparities exist for women too, and the numbers help tell this story. In a recent study of more than 19,000 people who had cardiac events, only 39% of women received CPR from bystanders in public, compared to 45% of men. In addition, men's odds of surviving a cardiac event were 23% higher than women's.
The American Heart Association is working to improve the response to cardiac arrest for everyone. Working together, we can raise awareness, improve training and access to training resources, and advocate for laws to protect responders. Blood pressure control, access to healthy foods, and hands-only CPR training. These are 3 pillars of the American Heart Association's work to build an equitable foundation of health in the Central Valley. And now is the time to take it to the next level. We need you to join us and help accelerate this mission and give everyone throughout the Central Valley the opportunity to achieve good health and well-being.